care's there. There just isn't the time to fit the care into a working day.
Jackie, thanks very much indeed. I must move on because we really need to speak to Phil McCarvill, who is the Deputy Director of Policy at the NHS Confederation. They represent 85% of NHS providers and commissioners. Phil, good morning.
Good morning.
Is Jackie right? Is the care not there?
I think what we've recently carried out a commission which looked at the care for older people, and particularly around urgent care. So what happens when people need care in an emergency, not an emergency, but actually when they need care that's to keep them well or to keep them in their own home. And what we found was there's some really, really good examples of how you deliver care, but the root of all of them is the fact that you build the care around the needs of the individual. Now, I can't comment on the individual case that Jackie's identified, but actually the principles that we worked on and developed in relation to the Commission, by speaking to experts and by speaking to people who use services, was around if you build the care around the individual, then you get better care. So you don't get a situation where someone's having their lunch at 11 their breakfast at 11 and their lunch at 12. What you're doing is making sure that the person gets the care that they want and they need. And actually, a lot of it is about changing the way that we deliver care. So taking some of the things that would traditionally have happened in a hospital out into the community, out into people's homes, to keep them well and prevent them ending up in hospital, because sometimes they end up in hospital and then end up staying for longer than we would want them to.
You obviously can't talk about specific cases. I wonder, though, if there's a bigger issue creeping up here, and Jackie mentions it. And interestingly, my mum packed in work when she was 52. Yeah. She retired, which she was able to, early retirement as a teacher, which meant she could spend a lot more time with both my elderly nans and an elderly auntie. Jackie packed in work at 60 to look after her mum. Well, I'm coming up towards 50 now. My mum doesn't need any help at the moment. She's far from it. But if she did, I can't pack in work. I'm nearly 50, self-employed, no pension, 12 years left on my mortgage. Our generations are different, aren't they?
Yeah, and I think what those experiences show is that we need to make sure that we're getting care right. That actually the solutions to this are to make sure that we are working more closely to make sure that health and social care services are joined up, that there aren't gaps, that actually we're making sure that people are receiving the highest quality possible care, that we're looking at the way that care is delivered across an area, and we're looking at the individual to see what they need, rather than saying they need a bit of social care, a bit of NHS care, a bit of primary care, a bit of different types of care. Actually look at what's the whole package that individual needs. But there is one other pressure, which is our members, which are delivering services and commissioning services across the NHS, like repeatedly telling us, is around the pressure on social care funding. And one of the things that we need to see is a move in the situation at the moment where most of the increase in social care funding comes at the end of the Parliament, comes in 2019, 2020. Actually, we can see the pressures on the NHS, for example, in the speed at which people can be discharged when they're fit and well enough to go back home and go back to their care homes. But actually the number of people who are having to stay in for longer than they need to is increasing. And actually one of the things we need to see is action in terms of funding for social care, because it's unfinished business in terms of when the government decided how it was going to allocate money at the start of the Parliament. It backloaded a lot of the funding into the end of the Parliament, and actually the pressures can be seen now, and actually that's creating pressure not only in terms of social care and in terms of the quality of services available, but also pressure on the NHS.
Phil McCarvill, thank you very much indeed. It's up to state now. Here's Nick.
Thank you, Toby. And we have some slow traffic heading in towards Doncaster at the moment.